So everybody, thanks for coming today. We're going to have a 15-minute session on a medical procedure known as the modified Seldinger technique. Okay. My name is Jim Willman. I'm the clinical nurse leader at University Hospital in the radiology department with responsibility for both radiology and for the PIC team. So essentially what we're going to talk about today is a technique that can be used for a variety of reasons, but we're going to talk specifically about how MST or modified Seldinger technique is used in actually getting access to a vein in the upper extremity to put a PIC line in, a peripherally inserted central line. Our learning objectives are here. MST defined, modified Seldinger technique defined. We're going to look at the equipment that is used from the actual MST kit itself and what it contains, and also the ultrasound machine that you'd use to actually visualize the use of the MST kit. We're going to just do a brief review of vascular anatomy, the things that we're kind of looking for in the upper extremity before we actually start getting access to vessels. And also, we'll do some ultrasound familiarization training, just on-off button, kind of how you can adjust your picture, how you actually hold the probe to view things, and we'll do all this in a hands-on fashion. And then we'll actually simulate with a mannequin arm the actual use of the ultrasound machine and the MST kit, and we'll actually get access to a vein, put a wire in the vessel, and follow that up with an introducer, which is the whole thing in a nutshell. The modified Seldinger technique is named after a Swedish radiologist who founded the procedure in 1953. Again, it's used to access not only blood vessels, but also you can use it to access hollow organs of the human body for like a PEG tube or other different things, or also the brain, as Dr. Sam says. Yeah. Anyway, thanks. Zoom in on Dr. Sam if you would for me there. Yeah. By the way, I was going to say, if anybody misbehaved during this little presentation, there's a trunk monkey over here that will come out with a ball bat and kick some butt. Okay, so everybody behave. All right. All right. Let's see what else I got on here. So here's an actual picture of the equipment that we're going to use. It is very simple. The kit contains a needle, a wire, and an introducer sheet that goes, and we'll talk about what order we do all this kind of stuff in, and we'll actually have hands-on with the equipment here. Here is the anatomy of the upper extremity. So there's essentially 3 different vessels that you can use to actually get access to float a PIC line in, which ultimately ends up in the SVC, the superior vena cava in the middle of the chest. But you have to, one of the most important things is you have to identify the brachial artery, because you don't want to stick a needle in the brachial artery. So essentially that's one of the other things that you need to consider when you're using MST. But there's the 3 veins. The basilic vein is the preferred vein. It's usually the straightest, biggest, and the most preferred for a PIC line. You also have the cephalic vein here. We try and avoid the cephalic vein. It's usually more difficult to put the PIC line through. But again, there's also brachial veins, which we do use to insert PICs. But again, you want to make sure that the nerve complex runs right with the veins and the arteries. So you want to stay away from the nerve and the artery in this situation here. And that is it for the lecture piece of this. Now we'll do the hands-on, the question and answer, and the discussions of the MST kit and use and all that. All right, does anybody have any questions at this point? Carl?
No.
You look like you've got a question burning.
No,
Thanks for joining us, Andy.
I think
Next time you're late, there'll be demerits.
I know.
Okay.
Sorry about
All right.
that.
Thank you very much. Okay, that concludes this part, and we'll move across the hallway and actually use this bad boy. Cool. All right, so here we go, everybody. Your ultrasound machine's here. It has the on-off button. Imagine that. Turn it off and on. And here's your display screen, and it shows you that you can actually see the different sizes of the vessel once you identify the vessels. You can see the haze, and there's a way to focus and change the contrast, light and dark and all that kind of stuff. You can change the actual depth that you're looking into the arm. Okay, 3 would probably be real good for most people. If you have a really big person with a big arm, you're going to want to increase the depth to probably 5 or whatever. And there's a way to do all that we'll get into a little bit later. So what I'm going to do is I just want to review the anatomy with you real quick in the upper extremity. To use the MST. So it's always easier. And if you're really doing a PIC line, you would have to do this everything would be sterile and all that kind of stuff. But just to review the anatomy, we'll look real quick. So if you want to step up here, Carl, and or Kim, and start looking, I'll show you. So you're going to hold the probe like this. If you hold it this way, facing you, then you can identify that this is the left side and this is the right side. And why does that seem backwards, Carl? Anyway, so you can actually see, well, it's a little too much contrast. You can actually identify, sorry? Okay, we can do that too. So right here, if you guys see the circle right in the middle of the screen, that is, as I push on it here, I would guess the brachial artery. And if you notice when you push on it, how it's still bouncing, that identifies an artery, okay? If it's a vein, we'll just class. Here's another big vein right here close to the surface. This is the cephalic vein, okay? So you identify in the middle of his arm, you know, kind of by landmarks, you know, from A and B as a nurse or whatever, that in the middle of the arm with the cephalic vein, and you can follow it up. You can see it even going away with the arm. You go over here and you have the brachial complex, which is where the brachial artery and nerve complex and stuff run. So as you go up the arm, you can identify this is the, again, the brachial complex, and if you drop down here, there, the big vein that's off by itself away from the rest of the brachial complex is the basilic vein. And that is, as you can see, giant vein, which is perfect for a PICC line insertion. Okay? Does anybody have any questions?
Show me the brachial.
Okay. So we'll go back down. You kind of know the brachial complex is in this portion of your arm here in the antecubital fossa, and it's right there. Again, you can see the artery bouncing.
Mm-hmm.
That's why it's so nice to roll over here. You get away from that whole complex and you find the basilic vein, knowing that there's no nerve and you're far away from the artery around here.
When you were looking further up in the arm, it almost looked like a little Mickey Mouse head.
Oh yeah, that's a good point. Thank you for bringing that up, Carl. Can you see that? Does everybody see Mickey Mouse? So you actually have two, if I can get it to stay on there while I'm talking, you have two ears, which are both veins, and then the third, the middle, the one in the middle that's biggest is the actual artery, the brachial artery. That's right, it does look like Mickey Mouse.
Yeah, it's not.
Yeah. You didn't know you had Mickey Mouse in there, did you, Dr. Sam? All right. So now we'll, if you want to turn that off for a minute, Chris, and then we'll move to actual stick. So this is what is actually in the MST kit, and we'll get I'll use it, I'll show you once, and then I want everybody to get a chance to play with it. There's just three components: an actual sheath, a needle, and a wire. Get them all out here. So what you do is get your needle. Be careful with this, because nobody gets hurt, okay? But because it's a real needle and a sharp on it. Once you get access to the vessel or the hollow organ, in this case, like I said, the vessel, because we're doing PICC lines, you get access with the needle, and you verify that with your ultrasound machine, essentially, and blood return. Once you get access to the vessel, then you actually take the wire. And this is the whole thing about the MST that's unique, is the wire goes through the inside of the needle, okay, into the vessel or into the hollow organ. Once you have that access, you just hold it in place and you pull the needle out, okay, and all you have left in the patient's body is the wire sticking out through the skin. There's obviously more to this, and then you have to use lidocaine to numb the skin, and you're going to nick the skin. This is all going to be a sterile procedure, but you get the gist. So once you have just the wire inside the patient, then you actually have a sheath that goes over top of the wire, and that's how you ultimately maintain your access. So you use the needle first to get access, then the wire, and then actually float the sheath right over top of the wire, right into the patient, and then you just pull the wire out, and you've got your access here. And you can put a cap on that, you can put your PICC line through it, you can do whatever you gotta do.
Doesn't that wire poke through the vein?
It does not. It actually has a little, if you feel how stiff that is, the back end of the wire is very stiff, and that probably would poke through the vein and do some injury to the intima of the vein, but feel how soft the end. See? So when it hits something that meets resistance, it just kind of, curls up. If it's not resistance. Good question.
Cool.
Good question, sure.